So about the viral hepatitis. Hepatitis viral families A, B, C, E. A is Picorna, B is Heparna, C Flaviviridae, E is Calliciviridae. Epidemiology. Hepatitis A is transmitted by fecal-oral route. It occurs more in children. It is the most common cause of epidemic of hepatitis in children in India. Hepatitis B is transmitted by percutaneous inoculation, sexual intercourse, vertical transmission from mother to child. As per WHO report that in Asia, there is 20 to 40% chance of vertical transmission in HBe antigen negative mothers, 90% of HBeAg positive mother, and 110% of anti-HBe positive mothers transmit HBV infection to their offspring. The most infections occur approximately at the time of delivery and are not related to breastfeeding. Serum, semen, and saliva are the most infectious for hepatitis B transmission. Hepatitis B antigen is present in all the body secretions except the stools. So, like, if you're gonna touch the stool, nothing's gonna happen. Okay, so like the most important points, the conditions in which there is increased prevalence of hepatitis B infection includes IV drug abuses due to obvious reasons, hemodialysis, PAN, which is polyarthritis nodosa, Hodgkin's disease, leukemia. So like bloodலயே நிறைய வந்துருச்சு. Hodgkin's disease வந்துருச்சு. Hemodialysis, okay. PAN, polyarthritis nodosa. Leukemia, okay. And then moving on to other diseases like lepromatous leprosy and Down syndrome. Moving on to hepatitis C, the mode of transmission are percutaneous, perinatal, and sexual intercourse. Hepatitis C is the most common cause of blood transfusion-induced hepatitis. The perinatal and the sexual route are seen in co-infection with HIV with high level of viremia, the risk being 5%. Breastfeeding does not increase the risk of HCV infection. Hepatitis D and E. Hepatitis D is the mode of transmission are percutaneous, sexual, and perinatal. E is the mode of transmission is fecal-oral route. Pathology. The typical morphologic lesion of all types of viral hepatitis are similar and they consist of panlobular infiltration with mononuclear cells, hepatic cell necrosis, and the hyperplasia of the Kupffer cells, variable degrees of cholestasis. Hepatic cell regeneration is present, evident by mitotic figures, multinucleated cells and rosette, and pseudoacinar formation. Mononuclear infiltration consists of lymphocytes, plasma cells, and eosinophils. Liver cell damage consists of A. Necrosis of the cell, B. Ballooning of the cells, C is acidophilic degeneration, which is apoptosis of the hepatocytes. Apoptotic hepatocytes are otherwise called the councilman bodies. Bridging necrosis indicates more severe lesion. In hepatitis C, there is relative paucity of inflammation. Okay, so the pathology shows hepatic cell regeneration as seen by mitotic figures, mononuclear infiltration, liver cell damage, bridging necrosis, and paucity of inflammation is seen in hepatitis C specifically. So in acute hepatitis, the main features which are seen include focal or centrifugal necrosis, ballooning degeneration, acidophilic degeneration of the hepatocyte called the councilman bodies, architecture changes. Clinical features of viral hepatitis: anorexia, nausea, vomiting, fatigue, jaundice, myalgia, headache, photophobia, coryza, cough, and pharyngitis. Serum sickness like syndrome occurs in hepatitis B, leading to urticarial rash, angioedema, high grade fever, and arthritis. Pain in the right upper quadrant due to enlargement of the liver. Splenomegaly, cervical lymphadenopathy are seen in up to 20% of the cases. Spider angioma appear during icteric phase and disappear during convalescence. Laboratory findings include raised ALT, AST, serum bilirubin is rise, prolonged PT associated with a poor prognosis, hypoglycemia due to nausea, vomiting, inadequate intake, and poor hepatic glycogen reserves. Microscopic hematuria, proteinuria, especially in hepatitis B. Elevation of gamma globulin, IgM is elevated more characteristically during acute hepatitis A. False positive RA factor and ANA in autoimmune hepatitis. Antibodies to liver kidney microsomes, which are LKM in hepatitis C and D. So that's it. We are done. We saw like pathology and stuff, epidemiology. Done. Thanks.